They send to us late, so we deliver late to the
Okay.
hospital. The perception is that it's Pharmaniaga who is late, but we are not. We are purely logistic and distribution company for pharma.
I'm Wong Xiaoning and this is the Breakfast Grille. No company would like to be classified as PN17 as this means that it's in significant financial distress. Today we speak to one such company that has just submitted their regularization plan to show their restructuring plans to revive the business and regain financial stability. Zulkifli Jafar, who is managing director of pharmaceutical company Pharmaniaga, joins us to tell us details of this plan and what is the future of their company. Now, Zulkifli, thanks for coming in, and let's take a step back, right? Because Pharmaniaga is a PN17 company because of a 552 million provision for Sinovac COVID-19 vaccines taken back in 2022. I just want to know a bit of a history lesson for us. Did that happen because of poor management decisions, or was it actually really national service since at that time we were in the midst of a pandemic?
Okay, thank you so much, Shani. A very good morning to you. Thank you for having me today. Okay, a bit of, yes, Pharmaniaga is under PN17 classification. The history is that the reason why we fell into PN17, as you have clearly stated, because of the provision of 552 million COVID-19 vaccine. But bearing in mind, for Pharmaniaga, we are classified as technical PN17. So which means we are not financially distressed company. So it's very important.
So you want to make a difference,
yes, different,
right?
because we are not financially because we took a wise decision at that point in time to provision 100% of the COVID-19 vaccine, despite the fact that you can actually just provision 50% because it has not been it's not expired yet. But anyway, so what transpired? It was, I think, most probably it was something totally new to everybody. It was a pandemic. The whole world was in rush for COVID-19 vaccine. So we were entrusted at that point in time to try and source as many as possible because COVID-19 was like, the vaccine was like a commodity.
Yeah, it was so scarce to find, right? Every government was chasing for it.
Yes. So it doesn't mean that when you have money, you can purchase it. Even if purchase it today, 3 months later, then only can get the COVID-19 vaccine. So at that point in time, we took into consideration the fact that, okay, we have vaccinated about 11 million population of the country. So naturally, when it comes to a booster, it should be you should use the same COVID-19 vaccine. But unfortunately, policy changed and the government decided that we can do mixed vaccine. So that was the point that it triggers us that this purchase, it might bring us to a, in a way, it's calamity lah. I would say that, But lesson learned, so we become more vigilant and when we improve in terms of our governance to make sure in future, even if there is another pandemic, hopefully there is none, but even if there is another pandemic, we will then take it differently. We learn our lesson well, so we know how to address it properly.
Okay, so let's get granular about that
Yes.
PN17 regularization plan. So there's a 520 million capital reduction, a rights issue of up to 354 million, and this is the most interesting one, the 300 million private placement. So was this the best plan after auditors had raised concerns about the company's sustainability to continue as a growing concern for the third straight year? I mean, because this is not the first PN17 plan, right? There was a revision. This is a revision.
This is actually this is a variation of the existing PN17, but the variation is not much different in terms of numbers that remain the same. It's just that the number of shares and how we want to do it. Because for this regularization plan, you have correctly pointed out, we have right issue, we have private placement and capital reduction. So previously, it was supposed to be done one after another, but now under the new RP, regularization plan, we have to do it simultaneously. Basically, the right issue and the private placement must work concurrently.
Okay, I think your rights issue is probably...
Our right is only about 353, but our right issue is fully underwritten, so it's not an issue so much.
The major shareholders, Bowster and LTFT, have undertaken it. But what about the placement?
Okay.
Zulkifli, who is taking up the placement?
Okay, thank you, Xiaoning, for I know it's an interesting topic. A lot of people have been asking us. We have, to be honest, we have fully, in terms of interested party, is fully, to me, is fully subscribed.
So you've identified.
But we have identified. But it's just that we have not made decision. So at the end of the day,
so you get to choose.
we get to choose because we have more than enough. So we get to choose who we want to be our partner.
Will you be choosing Perkeso? Because that's what the Edge says, that they could emerge as the white knight to take up the placement and emerge as much as with a 20% stake.
I'm not at liberty to disclose who are the parties that are interested because the board have not decided. But the basis of us in coming to a decision as to who should be our partners is actually basically we're looking at strategic partner, one, and second would be financial institution to show that this counter or our company is a viable company, and third would be maybe high net worth individual or companies.
So when you say strategic investor, assuming it's not Perkeso, could it be even another pharmaceutical company? Because if you look at a lot of transactions done overseas, it's very common for pharmaceutical companies to buy another pharmaceutical company or have cross shareholdings.
There's a possibility. We are looking maybe who are in line with our business because knowing well, Pharmaniaga, we have concession in terms of logistics and distribution, and we have manufacturing arm. So we are looking at those who can actually add value to the company because the reason why we are doing it is to enhance the value to the shareholders. Because we do not want somebody who comes in today when the share price market went up, they just drop it, sell it off. So we want them to be with us for long term.
And you're confident this whole PN17 regularization episode will be put to rest by the end of this year? What's the deadline for you all?
Yes.
Because I think Bursa gave you an extension by 3 months, right?
Bursa gave us extension to file in the RP, which we have announced. So once we have announced our price fixing, so basically we are on track already. The extension given by Bursa is until August.
So it's not 10 cents because that was what the
10
price
cents was the right issue. But the price placement is 13.5 cents.
Okay.
So basically, based on our target, by August, we should have raised everything. And hopefully, we should be able to exit PN17. The latest would be Q1 2026. The earliest would be end of this year.
So finally.
Finally, yes,
okay.
Finally. In fact, I think we are one of the fastest company under PN17 that completed within time.
Okay, because I saw one headline of company being in PN17 for almost 10 years. So I'm glad you're not in that company. But I do want to ask you something about the governance standards because you earlier on said that, it needs to be raised for sure, right? And it was a lesson learned. But who and will anyone be held accountable for this? And I do know that in your annual report, you did say that the stocking of vaccines, which did lead to this PN17, was in full compliance with the corporate governance standards. But being a lawyer, there's the letter of the law and there's the spirit of it, right? So don't standards need to be raised, and don't management or directors should be held to task as to what happened?
Thank you, Xiaoning. I think what we have done is, as I said, we've learned very big lesson, expensive lesson from the COVID-19 saga. So what we've done is actually, in terms of corporate governance, we have improved our corporate governance. We re-look back into every single policy of the company, from procurement up to distribution as well. So in fact, we have tasked immediately after PN17, we have set up a task force to look into all the policy, to revamp whatever is necessary or to improve the policy to make sure that moving forward, there is no such thing as, we make this decision without taking into consideration other elements as well.
The potential risk.
Yeah, the potential risk. So now, I'm very thankful to all my board members. Either they are accountants, they are lawyers, they're professionals basically, and
they're good watchdogs.
So they're good. So it makes us yes, sometimes of course the management feels sometimes it's very tough, but I think it is for the good of the company.
So they hold you accountable.
Yes, they hold us accountable.
Okay. Let's talk about the headlines I read, one of which is the 4 billion revenue target for 2025. How will that be achieved? Because I look at it very likely, because for the first quarter already, top line number was already 1B. So if I analyze the figure, you're there.
Yes.
So you're confident? 4B? Is that too low a bar then for you?
Actually, based on our estimation, generally it's supposed to be about 3.8 billion, but I'm very confident that we can hit 4 billion. Why? Because we have ventured into biopharmaceutical industry. So we are the sole biopharmaceutical plant in the country. There's no other competitor. So basically for biopharma, if you look into the market, for biopharma market alone is about 1.1 billion ringgit a year from Malaysia. Why? Because it is fully imported. Vaccines are fully imported by government. Yearly is about almost 250 million government spent on vaccine. So what we have done for our biopharma, see, CAGR for biopharma is actually quite good, about 17.8% CAGR. Why? Because you're talking about in light of vaccines.
Yeah, like flu. Now it's quite common, right? Flu vaccines.
So you can't get.
And one time there was no stock. Yeah.
So and then you have insulin. So and we are lucky because when we work on the vaccine, we work on vaccine under NIP, the National Immunization Program. Under NIP, there are about 11 vaccine, but we have 7 of those 11 vaccines.
So you have market share.
Yes, we have market. We are targeting. I mean, to be honest, we are targeting. By 2029, our yearly revenue just for our plant in Puchong, the Puchong plant is the biopharma plant, yearly revenue conservatively about 650 million just for one plant.
Okay,
so we're just dealing only in terms of insulin, vaccine, blood product, and the famous one nowadays is everybody wants to be slim. So we are working on liraglutide and also semaglutide.
I want to ask you about your government concession agreement because that's what Pharmaniaga is really known for. You supply more than 8,500 healthcare facilities and I think almost 1/3 of all government drug supplies. About there?
Yes.
So, and this contract lasts till 2030. I have a question about why you should be entrusted with such a critical role because it was just renewed and in fact rewarding a company that is still in PN17 and in the past didn't make the best decisions. So why should the government and in turn the rakyat who's dependent on the government for sometimes for drugs turn to Pharmaniaga?
Okay, thank you, Shawnee. Basically, for Pharmaniaga, bearing in mind we have 15 warehouses throughout the whole nation. So in terms of infra, it's already there, and we have even spent to build for a pharmaceutical information system. Because if you, just for information, all clinics and hospitals in the nation, they order through online. So that system is developed by us for government.
So basically you're saying the government has kind of no choice because you have this very invaluable infrastructure in place.
We have the infrastructure, plus if you look into our service standard with government is about 98% in terms of delivery. So we have never failed. COVID-19, yes, a lot of people have been asking, you're a PN17 company, why should government give it to you?
Yes.
But like I said in the beginning, we are technically, we went into PN17 because of technical. So, but we are not financially distressed company. So in that sense, that's the reason why immediately, even during the PN17, you can see our track record with government. Our achievement has always been 98% delivery. So we make sure, because under the concession agreement, you are given a certain deadline to deliver. So for local, for Semenanjung, it's 7 days. For Sabah and Sarawak, it's 10 days. If you're late, you're penalised. So there's all this penalty imposed by government to make sure that you are on time when it comes to, and we make sure that the country will not have shortage of medicine. The only thing that there's a lot of misconception about Pharmaniaga. Every time, even to the extent doctors, they are not aware that Pharmaniaga, the concession only in relation to logistic distribution. But who the government appoint as the supplier, it's not us. We cannot control that. So when the supplier send to us,
determine the drugs.
They determine the drugs. So when they send to us late, so we deliver late to the hospital. But the perception is that it's Pharmaniaga who is late. But we are not. We are just a logistic and distribution company. So I've been telling a lot of people the misconception is that we are purely logistic and distribution company for pharma in Malaysia.
Give your business the edge it needs with You Business Enterprise Solutions. Collaborate with us for unbeatable possibilities. Leverage on our 5G network and bespoke solutions to elevate your business in today's digital landscape. You Business Enterprise Solutions. 5G makes business sense.
I want to come back to the concession agreement because as we know, it's going to expire in 2030 and who knows what might happen then. Maybe the government might decide, let's do an open bidding, tendering process. Do you think at that time you can win the job solely based on your costs and your operational efficiencies? Because some people say you get this concession because you're a GLC.
Okay. Thank you again for that. Maybe just for clarification, it is not purely because we are GLC. We get the job because we have set up the whole infra for the country, and we have 15 warehouses. In fact, in the new concession agreement, government imposed on us to build another 4 more warehouses, strategically located. Is in up north, in Sabah, in Sarawak, and also East Coast. The idea is why? Because we want to make sure when we do delivery, it is within the cost.
Okay.
And we optimize. So the thing is, I think the way we look at it, we have embarked into cost optimization, and we look into every single angle as to how do we reduce cost, because government fee to us is fixed. But cost is escalating at the moment. So how then, whether a lot of people ask us whether it is a good business for us. To me, the business is good, but it's how you manage your costs. So what we have done is that with additional 4 more warehouses, we become more centralized and more efficient.
So I did a bit of a back of envelope calculation in terms of what could potentially be the margins from this government concession, because it's not really disclosed. So I would guess at best maybe slightly below 10%, single digit. So are you going to improve on that? Am I firstly too far from that number, and can you improve on this number?
Okay, in terms of the margin, yes, you are
about there.
You're about there, because we realize that in terms of the fee, the margin is not excellent. Logistic distribution. Then what can you do to improve?
Actually, it's pretty decent. I mean, if you look at other logistic companies in Malaysia, firstly, most of them are loss making, and if they did make money, it's literally like a 2-3%. So
I think
below 10 is quite healthy. Government is being generous.
Government is being generous, yes. But we know for a fact that cost is fixed. Then how do we improve in terms of our expenses? So what we've done is actually we have embarked into automation and digitalization. So we become more optimized, and because under the government concession, we are under an obligation to hold certain stocks to make sure there is no shortage in the country. So what we do is that for our inventory management system, we improve in terms of the inventory management system. We have reduced in terms of holding stock. So by us reducing it, because we become more efficient, we save just a slight reduction. We save in terms of interest cost by almost 7.6 million a year. Okay.
Now, what guarantees will there be this time that Pharmaniaga will actually meet those certain performance standards, right? Because I think if in the past, and help me understand this, maybe I haven't gotten it right, there were penalties amounting to 140 million to the government, which they kindly waived. Some would say that amounts to a lifeline, and I think in the past there was delivery of faulty ventilators. Is that all historical and not to be repeated? What?
It's all historical, not to be. But for clarification purpose, the 124 million penalty, it is not because we were late, and the reason why it was waived, because these are penalty imposed during COVID-19.
Okay.
During the pandemic. So what happened is that there's a movement restriction order. We can't go out. So, but because of the system that we built, the system that is implemented, so automatically the system will trigger that we are late in delivering.
Oh, I thought certain sectors were exempted from not being able to move.
But for us, we can't. We just can't move out. Okay. So there are a lot of delay, and all the suppliers, like I mentioned before,
couldn't deliver to you.
Couldn't deliver to us. These are from overseas.
Now, the other thing I do want to ask about, which I think Pharmaniaga is really pushing ahead, is manufacturing. Right?
Yes.
So it's only 50% of current revenue, but operating margins are much better than the logistic and delivery.
Distribution, yeah.
So eventually, what kind of split do you want to see between the logistics and distribution versus manufacturing?
We are looking, our target is at the end, we want it to be 70-30. 70% manufacturing, 30% will be our logistic.
And that's because manufacturing margins are what?
Yes.
40%?
40%, about that. Easily.
So, do you have the capacity though? Because you have 4 manufacturing plants now, including the one in Indonesia?
Yes. We have, because it's
What's your
currently,
current?
our current capacity for all our plant is, it ranges between 50 to about 60%, and this is based on the normal shift. So if assuming we are tasked with more contract, we are awarded more contract, then I just need to do a 2 shift, so I can improve. Because bearing in mind, for manufacturing plant, you cannot hit more than 80%. So when you hit 80%, there'll be a downtime, so become inefficient.
So you said you're going to make more than 90 new products, right?
Yes, we're about 91 products.
So I just want to know, how encouraging is the government, or how proactive is the government in helping companies like yourself? Because there is this National Pharmaceutical Regulatory Agency, right? And approval is required from them. So how easy is it, and is your failure rate very high? Because I'm sure, in US, getting FDA approval is not an easy feat.
I mean, to be honest, our NPRA, or National Pharmaceutical Regulatory Agency, is very stringent. And there's a reason why it is very stringent, to make sure, because you are talking about drugs. Drugs to be dispensed to the public, it has to go through certain stringent process before it can be approved. So what we have done is that, in order for us to evaluate this 91 product before it goes to the market, we set up a PMC internally. It's Product Management Committee. What we do is that we test every single product before it can go internally, to make sure that the product, say once we have done all those tests, so when we submit to NPRA, it'll be a lot smoother and faster.
Because a decade ago, I remember Pharmaniaga wanted to do injectables, and then it took a very long time, right? Has lessons been learned from that?
Yes, I mean, the plant is called the Small Volume Injectable Plant, which is in Puchong. Now the plant is, for information, it's EU GMP. It's one of the highest standard plant in the nation.
Took a while to get there, though.
Yes. So the same plant, we convert it into vaccine and insulin.
Okay. So what about your ability to compete with generic king drug makers? Because it's a very competitive market, right? So you've got the likes of Sun Pharmaceutical, Dr. Reddy's, Aurobindo. These are all the Indian giants. They have scale. And I looked at their operating margins. It's all double digit, high double digits, some 20, some almost 30, versus yours current single margin. So can you really compete?
Okay. What we do, we know it is very difficult to compete with all these Indian manufacturers, plus from China. But they are our partners. So what we do is that we enter into this technology transfer between them. So we work with them to make sure that medicine that is supplied to the government is affordable, to the patients are affordable. And when you do technology transfer, then we eventually localize it in our plant. So basically it's manufactured in Malaysia. So the cost will be cheaper, and we ensure that in terms of security, medicine security is there for us to manage it.
Now, I'm sure you've seen all these headlines about medical inflation, right? In the country, it's around 15% in 2024. How responsible are drug companies like Pharmaniaga to blame when it's much higher than the global average of 10%?
No, I mean, that's the reason why what we are doing. That's why we are encouraging generic.
Okay.
Personally, I've been promoting the idea of trying to get all private hospital to dispense generic before you go for originator. Why? Because the cost of medicine has gone up so drastically. Inflation, like you said. So for Pharmaniaga, we are responsible to make sure that the cost of medicine is affordable to the nation, because we supply mainly to government, because the government is the biggest purchaser of medicine in Malaysia.
Have they been putting pressure on you in terms of the pricing of the medicines you supply to them?
Pricing is actually negotiated every 3 years. So every 3 years, then we have to go back to...
And if the price is only one way down.
Unfortunately, that
good for us, Rakyat.
I think it's good for Rakyat. To me, that's the reason why we're trying to do more localization. We try to do in-house.
Okay.
Because when in-house, we can control in terms of cost. So we can give better price to the Rakyat.
Now, let's talk about Indonesia. It's another market you're in. You have one factory there. It's actually the largest pharmaceutical market in Southeast Asia, but it's also highly competitive, right? It's got 2,400 logistic and distribution players and over 220 pharmaceutical manufacturing companies. Are you just a small fish in a very big pond?
Okay. Indonesia, we have 2 subsidiaries. One is PT Millennium Pharmacon. PT Millennium Pharmacon is a listed subsidiary of us in IDEX, Indonesian Stock Exchange. So and the other one is PT Arita. Arita Pharma is a manufacturing plant in Bandung. But for our logistics and distribution, We are currently rated number 3 in Indonesia. We have 36 warehouses throughout the whole
Are you
of Indonesia.
profitable there already?
Yes, we are profitable. Actually, Indonesia contributed about 30% of our revenue.
31% in 2024. So you're going to see the number increase?
Increasing, yes.
Okay.
In terms of revenue, in fact, for last year, we made about 1.1 billion. For 2025, we are targeting about 1.3 billion from Indonesia alone.
So, Zulkifli, how do you manage between the conflict between being a GLC, sometimes there's national service, while also being a listed public company where the golden rule is maximizing shareholder profit? Do you struggle with this?
It's a bit tough to manage, but luckily because we have governance, we make sure that whatever we do, it must be in accordance with the governance. So we set up a policy knowing well that we are GLC, but at the same time we are listed company. There are
So
rules
which
that
comes first?
No, it has to be whatever is in accordance with the law. So we
Okay.
do not want to break the law. So it is not easy. It's quite challenging. There are times it's quite challenging.
So you're a double bottom line company.
Yes,
That's the
it's
term right now.
But we can manage it. I think as long as to me it's very important that when you run an organization, it must be first there must be a trust in you, and secondly you must always take into consideration the interests of the shareholders.
Which is my last question. Your share price last traded a high of 98 cents way back in 2015. Today is around 23 cents.
Yes.
Can your glory days be achieved again?
Yes, we are quite confident. In fact, we target hopefully even for our market cap, we target to hit 3 billion by 2030. Because currently it's market cap about 300 million, but by the time we completed our regularization plan exercise, it'll go about 900 million. So we're targeting by 2030, we will hit about 3 billion. And PAT will be more than about 300 million.
On the Breakfast Grille this morning was Zulkifli Jafar, Managing Director of Pharmaniaga. Thank you so much for your time. I'm Wong Xiaoning, BFM 89.9.
Thank you so much.